Welcome to the Genius Factory. Enjoy the video.
In this video, I will explain how to inject hyaluronic acid into knee, prepare sterile supplies, and confirm patient consent before starting. Begin by positioning the patient supine with the knee slightly flexed to relax the joint. Identify landmarks and mark the intended injection site, usually lateral to the patellar tendon. Clean the area with antiseptic and allow it to dry. Use appropriate needle size and hyaluronic acid formulation per protocol. Then monitor the patient after injection for adverse reactions. In this video, I will explain how to inject hyaluronic acid into knee. Find the superior and inferior patella borders, then follow the joint line laterally. Use the lateral mid-patellar approach for most injections, inserting the needle parallel to the tibial plateau. Aspirate gently to confirm you are not in a vessel, then advance the needle into the synovial space. Inject the hyaluronic acid slowly, observing for patient discomfort, and withdraw the needle smoothly while applying gentle pressure to the site. In this video, I will explain how to inject hyaluronic acid into knee. Quick recommendation: the Echo Dot smart speaker brings music and timers to your procedure room without taking up space, making hands-free timing simple and fun. If you are finding this video helpful, please subscribe and like to support more practical guides. Check the description for the link and other deals, and remember, now let's get back to the video. In this video, I will explain how to inject hyaluronic acid into knee. After injection, apply a small pressure dressing and advise the patient to avoid strenuous activity for 24 hours. Recommend over-the-counter analgesics if mild soreness occurs and ice for brief intervals. Counsel on signs of complications such as fever, increasing pain, or excessive swelling, and provide clear instructions for urgent follow-up. Schedule a check-in to assess response and plan subsequent injections if indicated.
Thanks for watching. If you found this helpful, don't forget to like and subscribe.